Ugh. I've been feeling this discomfort in my chest lately. It's like this burning sensation. Feels like something's coming up my throat. Ever experienced something like that? Maybe it's heartburn. Or maybe acid reflux. Or wait, is it GERD? Well, aren't all that just the same thing? Anyway, do you have any antacids? What's up, guys? I'm Dr. Babes, and welcome to another episode of The Good Doctor, where we talk about medical tips and your health concerns. For today's episode, we're going to talk about acid reflux. So if you're ready, let's get into it. Nothing beats indulging in your favorite spicy, rich foods. That is, until your heartburn sets in, and you're scrambling to find the nearest antacid or drinking herbal teas in hopes of easing the pain of acid reflux. If you love spicy, or coffee, or even chocolates, then you might be personally aware that heartburn means a painful burning sensation in the middle of your chest. But did you know that heartburn has nothing to do with your heart at all? Heartburn, also called acid indigestion, is a common problem. It's even more common if you're pregnant or an older adult. It's actually a symptom of something called acid reflux. But before we get into that, I have to give you first a little bit of a description of how your digestive system works, because we're going to need that as we go along. So your digestive system is basically everything that digests and absorbs nutrients from the food that you eat. It starts here in your mouth, down to your throat, then your esophagus. The esophagus is the muscular tube that connects your mouth to your stomach. Your stomach over here in the upper left quadrant now connects to your small intestines, to your large intestine, which then goes up into your booty hole. So basically, your digestive system is this long tube that connects your mouth to your butt. Yeah. So anyways, when we talk about acid reflux, we talk about what happens. At the bottom of the esophagus is a valve called the lower esophageal sphincter. This valve opens to let food through and then ideally closes to keep all the stuff in your stomach. And you'll want to hold that stuff down because inside the stomach is a very strong acidic mixture that continues digestion. And it's about 1,000 times more acidic than orange juice. Your stomach is specially designed to handle this kind of mixture. Now sometimes, the valve that separates your stomach and esophagus doesn't close properly, and the mixture sneaks back up. And this is called the acid reflux. The esophagus is not designed to handle this unbelievably acidic mixture, so it gets irritated and you feel every bit of that painful burning feeling called the heartburn. Well, there are different descriptions of heartburn, but usually they say that this is like an acid feeling in your chest and sometimes also in your stomach. It sometimes even reaches the throat or mouth, giving that sour or acidic taste. It can also feel like burning sensation in your throat. Another thing that you can often feel is constant belching and burping. Bloating tends to be a little bit of an issue, as well as indigestion. Generally, anyone can experience acid reflux. If you had a big meal or if you had fatty food, then you can start to burp and belch. If you only have heartburn occasionally, it may be a nuisance, but it's usually nothing to worry about. However, if your heartburn keeps returning or it won't go away at all, you may be experiencing chronic acid reflux. And that is when it's called GERD, or Gastroesophageal Reflux Disorder. So when you have GERD, the lower esophageal sphincter, or the opening from your esophagus to your stomach, is weakened. So it kinds of open up a little bit here and there. So when there's a buildup of acid and stomach content, it's easier for it to backflow, and that backflow causes the heartburn that you feel. So how do I know if I have GERD? Do I just have to think, oh, I've had acid reflux for so long. Does that automatically mean that you have GERD? Well, the diagnosis of GERD is often based on a combination of clinical symptoms, response to treatment, and diagnostic test results. Heartburn of more than twice a week over a period of several weeks, or constantly taking antacids, yet your symptoms keep returning, you may have developed GERD. Some people have GERD without heartburn. Instead, we experience pain in the chest, hoarseness in the morning, or trouble swallowing. You may feel like your food is stuck in your throat, like you're choking or your throat is tight. GERD can also cause a dry cough and bad breath. So it's very important to note that if you suffer from chronic acid reflux, do check with your physician to see if there is something else that needs to be addressed. You said that acid reflux kind of happens for everybody, so it's like, no problem, it's common, it's all good. Yes, GERD isn't life-threatening or dangerous in itself. But if left untreated, GERD can lead to complications over time because acid shouldn't be going up to here and everywhere else. You can develop chronic cough, asthma, or dental erosions because the acid should not be in that area. It can cause ulcers in your esophagus and bleeding too. About 10% of people who have long-term GERD develop Barrett's esophagus, which is basically thickened, damaged cells in the esophageal lining, which is a risk factor for cancer. So you gotta take GERD seriously. Common causes of GERD includes what kind of foods you ingest, how big your meals are, and even how close to bedtime you eat. Heartburn can be also caused by pressure on the abdomen, like wearing tight clothes or, say, growing a human baby can cause. So it's no wonder why some pregnant women experience heartburn almost daily. In managing GERD, your doctor is likely to recommend that you first try lifestyle changes and non-prescription medications like antacids to neutralize it, or medications to reduce or block acid production. If you don't experience relief within a few weeks, your doctor might recommend prescription medication and additional testing. Lifestyle changes include maintaining a healthy weight, stop smoking, and changing the habits that seem to trigger your heartburn, like eating at least 3 to 4 hours before going to bed, or sleeping on your left side to speed up the removal of acid from your stomach. Or you can also elevate the head of your bed, usually higher than your feet, to prevent those acid reflux. Of course, nutritional and dietary changes are needed, but nothing too crazy. Don't overeat, eat more slowly, small frequent meals. Please don't skip your meals. And also knowing your trigger foods. In finding your trigger foods, it is important to know that it is different for every individual. But the most common trigger foods that we usually have are high-fat foods, caffeine, chocolate, onions, peppermint, carbonated beverages, alcohol, and citrus fruits. Keeping track in a food journal might be helpful if you haven't learned what sets you off. It can be up to you how you want to do it. You can download an app to monitor your food intake, or just simply write down the food that you eat, and then write down what you feel that day and even the day after, because sometimes you're all good and fine, but then the next day, that's when you feel an acid attack. An entire box of pizza.
Nice.
There is no magic diet or specific diet for those with GERD. It's really just about learning about yourself, figuring out what affects you, and timing it well. For example, eating citrus fruits after a meal instead of before, or pairing it with non-trigger foods to have something like a buffer and balance everything. Today, let's create a very simple snack you can make for all our acidic girlies out there. We just need 3 ingredients: an apple, peanut butter, and your choice of nuts. So while I prepare these, a common question I frequently encounter is, how can I enjoy my coffee? I love coffee. I need coffee. I can't function without it. Like most trigger foods, you have to test it out. You have to see how much of it can you take before your acid reflux starts to kick in. Some can tolerate a cup, and others can only take a sip before their body starts to hate them. You also have to see what can you pair it with to help lessen the impact. For example, maybe having coffee first thing in the morning is what's triggering you, so instead, have it after a meal. Or maybe it's the high-fat milk that you're adding it in your coffee, so definitely check out the creamer you put in. It definitely does take a lot of trial and error and understanding yourself. So we're just gonna put a little bit of peanut butter on each piece. So just a little bit, because sometimes peanut butter can aggravate acid reflux. So you can actually opt for almond butter because sometimes that can be a less stressor. So another question commonly asked is, can I still drink a lot of alcohol with acid reflux? Well, I'm gonna have to give you some bad news. If it's one of your trigger foods, it's definitely going to be hard to drink a lot of alcohol with acid reflux. Or you can also just, prepare yourself to what's going to happen after. Aside from the hangover, of course. So we really just want to have as much unsaturated fats as we can have. So here, those are nuts. I'll just chop them up nicely. And then we're going to sprinkle it on top of this. And ta-da! Here's our snack. Okay, looking good, huh? Now it's time for the taste test. So let's get a piece. It's so simple, but flavorful. Not very extra, but definitely great for a snack or a dessert. And definitely acid-friendly. Take note that just because we do these nutritional changes doesn't mean you're automatically going to feel changes in your acid reflux. These does take time, so you gotta get used to it. It needs time to adjust to the things that you're doing, so be patient and try to understand yourself. I hope you enjoyed our episode today, and if you have any health concerns or you want to know about your own health conditions, comment down below so that we can get to yours in the next episode. Hopefully, we'll see you guys there. Till the next one, bye!